Good morning, good afternoon, good evening to everyone who's watching this podcast. My name is Peter Molyneux. I am the England lead for the Global Leadership Exchange, and I'm also the co-chair of the 2S LGBTQ plus collaborative at the Global Leadership Exchange. Today, I'm really delighted that we have Bilal Karimbocus with us. Bilal is the winner of the Professor Michael King Rainbow Special Interest Group Essay Prize from the Royal College of Psychiatrists in England for 2025. And Bilal's kindly agreed to join us today, talk a little bit about the essay and a little about his thoughts in terms of some of the challenges that might be ahead and how we might approach those. So Bilal, welcome.
Thank you.
Do you want to just say a little bit about yourself to start us off?
Yeah, no problem. Thank you very much for having me here today. My name's Bilal, and I am currently working in Northern Ireland. I'm very fortunate enough to be in a joint academic post at the moment. So half my time is based working in the NHS in a psychosis prevention team. There's only five of them across the UK, as far as I'm aware. So it's quite a specialised team. And then the other half of my time is based kind of more in academic work, so research with the Impact Research Centre or teaching and education within Queen's University of Belfast. So I've had quite a varied year this year, and I'm rotating into liaison from August. So very exciting
Fantastic.
time.
Well,
Yeah.
it sounds fantastic, and thank you very much for coming here. So, do you want to say a little bit about what led to the development of the essay, the approach the approach you're advocating?
Yeah. As part of this joint academic post, I've had a lot of time to kind of be involved in research, and some of the projects I was involved in earlier this year were for the Public Health Agency and the Regional Trauma Network around mental health and all policies and mental health inequalities in Northern Ireland. And then from that, in the Rainbow Special Interest Group newsletter, I saw this competition, and it was on approaches in tackling mental health inequalities within mental health, and it's something that really interested me. One, to learn more about, but also to kind of consider what maybe I as an individual could do, or systems and governments could do. So I kind of just took it as an opportunity to both educate myself and learn a bit more about the topic. Um, so I can maybe briefly outline the essay. I guess the first thing I did was really think what is meant by mental health inequalities, and I took a definition from a document by NHS England. It's quite a wordy document, so I won't repeat the whole definition now. But one of the
Mhm.
key things from that definition is that mental health inequalities are preventable, and it's the very first word in that definition. It really struck with me that the inequalities faced across the system, whether within LGBT populations or any other protected characteristic, it's a preventable phenomena. So it should be afforded the time and consideration by individuals, leaders, and governments. So that was kind of the very first thing that struck with me. And I guess there are various reasons we should be tackling mental health inequalities. Firstly, kind of from a medical ethics point of view, justice, making sure there's equity for um, all individuals that wish to access the healthcare system. There's also the statutory requirement for governments to ensure care for all individuals in a country is accessible and available, but also kind of in a more crude way, like from a financial perspective, if we can help people earlier on in their health journey, they're less likely to avail of crisis interventions, which are usually more expensive than early intervention approaches. So there are a good few reasons to kind of think about this and think about it properly. Um, and so within the essay, I kind of used a framework that was developed by the National Collaborating Centre for Mental Health and kind of applied it to LGBT inequalities. And it talks about kind of four key stages.
Mhm.
The first stage is kind of identifying the mental health inequalities and truly understanding what is going on at the moment, what's going on out there. Stage two is designing and kind of thinking about ways to tackle these inequalities. Stage three is delivering and actually getting down to it. So You can't just rush into stage three. There's a lot of prep work that needs to go into it before. And then I think most importantly, stage four is evaluating,
Yeah.
making sure what we're doing is working, and if not, going back to the drawing board, redesigning, retesting. So those are the four key stages, and throughout the essay, I kind of highlighted various aspects of that.
Yeah. And what challenges do you foresee in terms of trying to implement that framework?
Yeah, I think if we even just start with stage one, identifying, I think just getting a good grip of what is going on at the moment is tricky for various reasons. A lot of data that is collected tends to be in silos and it's not well integrated. So having systems that are connected is really important. So if we think about just data on LGBT individuals, for example, in Northern Ireland, the recent census didn't gather any information on gender. So how are we meant to know how many individuals from the transgender community
Mhm.
are here and what services they might need? So even just very basic things, I think, can be done to kind of help with step one in that process.
Mm. And in terms of gathering data, I mean, how do you make sure that that's actually then translated into action?
Yeah, yeah, that's a really good question, and I think it would be tricky to answer in a short podcast like this, but I think I think getting data on kind of outcomes, getting data on experiences, getting data on um, what services are available, like a real breadth of data will really demonstrate what the inequalities are. Like we all know that there are inequalities out there, but without kind of that evidence behind it, it's really hard to kind of design and
Yeah.
deliver changes
Mm.
down the line that will actually help those individuals.
Mm.
Um, so kind of getting a very holistic picture of the inequality is probably a really key, important first step.
Yeah.
Um,
So there's something about, it sounds to me that there's something about making sure that we're being curious and continually asking questions rather and
yeah,
not making assumptions, and then making sure that we're then gathering the right information and the right evidence that then supports both action
yeah,
and then follow that up with evaluation to test that is actually working.
yeah. And I think doing it in a meaningful way, in a way that is safe for
Mm.
both the systems and the service users that we're collecting data from. A lot of time with the LGBT population, I suppose, if the system they're interacting with doesn't feel safe, that
Mm.
data might not be freely available. So it goes back to like attitudes and the historical context of that specific community
Mm.
as well, which um, takes longer to change and takes time, to permeate through society systems. Or yeah,
Yeah. So, I mean, you've sort of started to answer, I suppose, what I was thinking about in terms of the next question. But I mean, what would you like to see others doing, both in terms of other leaders who are LGBTQ plus, but potentially also allies in this space doing?
I think in terms of leaders, I think um, being an advocate and being visible is really important, and ensuring that LGBT health is kind of clear and transparent and is a priority. And I think being neutral and kind of sitting in the middle and maybe not being as vocal about it is maybe not enough. And actually like saying kind of more explicitly is really important. Particularly for someone in a leadership position because it can set the organizational culture. Um, so that I guess that would be kind of a really important thing. And then for kind of people in non-leadership position, think or just being constantly being curious and seeking out resources to educate on very fundamental things. And if um, the time and consideration is there to kind of look into a bit more detail about the various aspects.
Yeah, because I mean, we were both recently at a Royal College of Psychiatrists conference, and I was really struck by the need to make sure we're looking at medical education and the way in which we're looking at the examples that are used within medical education, as well as specific education around different protected characteristics. I mean, do you feel we got some way to go to get medical education
Yeah,
where it needs to be?
I do think medical education has improved a
Yeah.
lot. And um, even like the medicalization of the LGBT community has improved a lot. So if we went back like 50 years, homosexuality was considered like a mental disorder. And kind of in the recent ICD-11, gender incongruence, which is a term is used, was in the mental health chapter up until quite recently. Now has been moved into the sexual health chapter. So
Mm.
even that has changed in terms of how the medical profession is viewing this whole group of people. And that does permeate through like how society then views these people. But the issue, I guess, with medical education is sometimes if it's not done well, it can feel quite tokenistic.
Mm.
Um, and so it's really important to have have that co-production with with people from that community to make sure it's representative, it's accurate, it's not like insulting or rude. And I guess a really good way to do that is kind of link in with the voluntary and community sector, and that's usually more of a safe place for people from any kind of marginalized group. The voluntary and community sector tends to be a place where advocacy happens and tends to be a safer place. So bringing those groups in to help with curriculum changes is, I think, a really important method.
Yeah. So when you sort of think about the kind of leadership styles that you see around you, and when you think about, what you're looking for from leaders, what do you, what does being a good leader mean to you, I suppose? But also,
Mm.
what do you think the leadership style now needs to be in terms of the kind of challenges we're facing?
Yeah, I think for me, on a personal level, a good leader is someone I can look up to as a role model,
Mhm.
and someone who um, is kind of authentic to who they are and the values that they want to bring to that society or that organization, sorry. Um, and for example, at that conference we were at, Dr. Pavan Joshi, who was the chair of, or the outgoing chair of the Rainbow Sub group. I felt like he was very authentic. He like ran that conference,
Mm.
with the executive committee, but I just looked up to him as kind of a leader that I could see like inspiring me to kind of follow in those footsteps. And it's kind of motivated me to kind of be more involved with the
Yeah.
Rainbow Special
Mm.
Interest Group. So
Mhm.
I guess that kind of links into that transformational aspect of leadership. Through watching him and observing him, it's kind of inspired me to kind of continue with that. So I think elements of authenticity and transformation are key. But also just having a leader that actually gets does what they are saying they're going to do, like kind of follows through is really
Mhm.
important.
Mhm.
Um, I think that's maybe sometimes missed, and I think having promises and targets is really important, and being able to look back and say, oh, like we have achieved these, or we haven't achieved these for whatever reason. Um, it's kind of a really important step as well. Puts a lot of trust in the people that are in non-leadership positions.
Yeah. So do you think there are any particular challenges for those of us who are LGBTQ plus in terms of being authentic?
Yeah, I think being a leader and being LGBT does kind of present with its own unique challenges. As leader, everyone in kind of a non-leadership position is looking up to you for values, ethics, guidance. And a lot of people may come with like their own kind of ideas about a leader and about someone from the LGBT community. And as we know, both those groups are really diverse in nature. So you're kind of having to find your way in both your own leadership style and how to professionally represent your LGBT side. And that can be tricky to kind
Mm.
of maintain both a professional but approachable, friendly, and personal level. And I think navigating the professional and personal aspects can be tricky.
Yeah.
Um,
I mean,
but but not doing that, I think if you kind of hid away that personal side, one, it makes you look less authentic,
yeah.
and two, it you're not acting as a role model or someone who is empowering other LGBT people below you.
I certainly think that's something that I observe has changed in terms of how visible people need you to be,
Mm,
and how you navigate what's the right level of visibility and authenticity, whilst also needing to recognize that you're leading for the whole organization, not just
yeah.
not just for one particular group. So I think there are particular challenges.
I think that requires a certain level of kind of emotional intelligence of knowing what is appropriate to maybe bring into like the professional setting and what is maybe less appropriate and more in the realm of like personal friends and kind of navigating what is appropriate to share and
Mm.
bring into that setting. It can be a challenge.
So what's next for you?
Yeah, I guess I'm still quite early on in my career. So I'm trying to make the most of it, opportunities that come my way, and I would really like to be more involved with the Rainbow Special Interest Group. So I'm kind of linking in with the Royal College to see if there's any possibilities of that. I'd be really interested in doing more research around health inequalities,
Mm.
particularly within that group. But more generally as well, I think the intersectionality
Yeah.
aspect for ethnic minorities and the LGBT group is maybe an even more understudied group of people, and there's probably a lot of work that can be done on that. Um, and then hope down the line, I kind of want to continue with like that academic side of my career and progress with that. So yeah, lots of exciting opportunities, hopefully, in the
Yep.
next few years. So yeah,
Fantastic. Thank you very much. Well, well done on both the essay and winning the essay prize. Um, we'll put a link to the Royal College website where the essay is hosted so that people can have a look at the full essay. But thank you very much for coming and summarizing it today and also coming and sharing your thoughts on what that means in terms of leadership and being LGBTQ plus. Thank you very much.
thank you.